Dr. Marchand Giese here with your Science Moment. Today I want to talk about the hierarchical arguments against the COVID interventions. And of course, in anything that you're arguing, there's often a hierarchy of arguments that one might have. Often there's like the most key sort of argument that you have, and sometimes you'll take up other arguments that are not so much key, but still they would suffice, even though you don't necessarily rely on them. In the case of COVID, there was at least 8 levels of such arguments, amounting to a hierarchy of 8. So let me just run through them. All right? So number 1, there was no emergency. The data showed it was a nothing burger even in early March 2020. We saw this from the Princess Cruise. We saw this from data even in China. The Center for Evidence-Based Medicine was covering this as well. It looked as if the average infection fatality rate, which is of course including all of those with many comorbidities, was around 0.2 to 0.3%. And we've since learned that if you were under 70 and healthy without comorbidities, it was around 0.05% or less. Right? There was no emergency in the first place. 2, confusion justifies nothing. Even if the data were unclear, uncertainty doesn't justify overturning society. That is, you can't have people say, well, we really didn't know what was going on. What? And so it was okay to violate civil liberties en masse because you didn't know what was going on? That's not how civil liberties work. Even if you did have strong knowledge, well, we'll get to that. That's a later part of this hierarchy, right? Confusion justifies nothing. Number 3, people are prone to seeing the apocalypse. Even if the data about a perceived pandemic appeared certain, one must doubt it, as people have an instinctual fear of the mythical pandemic and are prone to seeing one where there is not. And I've talked about this in this sort of this Bigfoot, this notion of seeing Bigfoot. There's a lot of similarities between the kinds of fears that we had and the kinds of fears of mythology that I've covered in previous pieces at Loofwire. That was number 3. Number 4, the interventions don't work. The interventions didn't slow the spread. They were recommended against as of 2019 and were only done out of panic, looking to be doing something and copycatting other nations. And since then, study after study shows there is no correlation between intervention's stringency and pandemic severity. Something we already pretty much knew beforehand. Number 5, even if all those first 4 things were not true, number 5, intervention harms. Even if the interventions had narrowly slowed the spread, no cost-benefit analysis was done, demonstrating that the benefits outweighed the harms. Instead, the one thing, infections, received infinite weight to all else. The interventions, in fact, had epic harms, as we've covered here on for the last 4 years, especially in poorer classes and the developing world. Number 6, crimes against humanity. Even if the interventions had narrowly slowed the spread and cost-benefit analyses were in its favor, and we could trust the analysis wasn't biased, such analyses never consider the inevitable creation of an unclean outgroup, like me and probably you. Those who are skeptical of the interventions thrust upon society, who can easily become the victims of democide, and if that happens, the mainstream community will only say to themselves, good riddance. Number 7, even if the interventions worked and had no harms of any kind, people would do them voluntarily. You didn't have to make them mandatory. People would do them voluntarily, as many did. For example, who was all those people that were wearing masks in their cars? All those people in cities, like when I visited DC in 2021, early January 2021, the entire city, even people on boats, were wearing masks. It wasn't required. They did it voluntarily. They went beyond the mandates. And number 8, the last and most important reason, inviolability. Even if the interventions worked, and so on, all the way 1 through 7, and people wouldn't do them voluntarily, our civil liberties are for the perceived emergencies. Right? Our civil liberties are for the perceived emergencies. And in fact, as I've discussed in other kinds of videos, our greatest emergency is the violation of civil liberties. All right, so those are the 8 And there's potentially more that could be interleaved within these arguments against the medical authoritarianism that occurred during COVID, and that was your science moment.